দীপ্ত টিভির সাপ্তাহিক আয়োজন নিটোল টাটা বিজ ট্রেন্ডসে স্বাগত জানাচ্ছি। আমি আব্দুল্লাল মামুন। আজকে আমরা কথা বলবো মালয়েশিয়ার হেলথ কেয়ার নিয়ে। আমাদের সাথে আজকে অতিথি হিসেবে উপস্থিত আছেন মালয়েশিয়ার মাকোতা মেডিকেল সেন্টারের সিইও মিস্টার স্ট্যানলি ল্যাম। Hello, Mr. Stanley. Welcome to our show. So, would you like to introduce yourself as well as your medical center?
Yeah, Mr. Maimun. Thank you for having me today. Myself, I've been working in the healthcare industry since 2003, and I was the CEO of another growth hospital in Kuala Lumpur before I come down to Malacca. So before I introduce my hospital, I would like to give a brief about where the hospital is located. And the hospital is located in Malacca. If let's say any one of you who don't know about Malacca, right? So you know that there's a name called Straits of Malacca, in which it connects the east to the west. So the Straits of Malacca getting the name from Malacca itself. So many years ago in the 15th century, a prince came from Indonesia, Sumatra Island, come to this place, saw a deer under a tree, and they asked, right, so what tree is this? They say this is a tree of Malacca. That's how Malacca got his name, right?
Okay, interesting.
And that's where the Malay kingdom was formed, right? And from there it spread to the peninsula. So the Malay kingdom was last for about 1 century. So in 1511, the Portuguese came over because during that time, Malacca became a trading hub between the east and west. So many sort of merchants from China, from Middle East, they come to Malacca to trade. So the Western people also came over and they conquered the place, right? And after that, when they control Malacca, right, the other Western group, which is the Dutch, also came over and won the war against the Portuguese and controlled the place again. Then eventually that place fell into British hand. And today, when you walk and you come to Malacca, you will see a lot of historical landmarks which left over by all these people. So it's full of culture and diversity. And this place has been named as a heritage city under the UNESCO in year 2007.
Okay.
So Makota was located right smack in Malacca itself. So within a walking distance, you can see all these historical landmarks. So now let me introduce my hospital, right?
Yeah, definitely.
My hospital was established in 1994. In fact, this hospital was built on a reclaimed land. Initially, we just having about 60 over beds. Then since then, we have increased it to about 300 beds. So some history about our hospital was that we ventured into medical tourism since year of 1999 itself. And during the first year, we had about 500 patients coming from our foreign country like Indonesia came over. And today, I'm proud to tell you that we have about 100,000 foreign patients annually coming to our hospitals.
Oh, that's a significant number.
It is. And we become one of the very well-known hospitals in doing medical tourism. And in fact, we are among the top 3 hospitals in the whole Malaysia who is very active in medical tourism.
Okay. So, can you tell something more, particularly the specialization and others for your Makota Medical Center? What is famous for Makota Medical Center?
Well, I think we are a tertiary hospital in the first place, right? And over the years, we have built up our medical capabilities. We have very highly specialized medical specialists inside our hospitals, and our hospital is very surgical based. We have performed numerous kind of surgeries over the years, and cancer is one of the main surgery that we perform, from brain tumor right up to stomach cancer, right up to liver cancer, right up to breast cancer, colorectal cancer, you name it, and we do it every day, right? And because of our surgical capabilities, we have built up a very strong cancer center in the hospitals, and our cancer center is considered as one of the most advanced and comprehensive cancer center throughout Malaysia. So we have one of the latest machine, we call it Tomotherapy Radisec X7. In fact, when we installed this machine in a few years back, we were the first hospital in the Southeast Asia who installed this machine in our hospitals. And after that, right, we continue to upgrade our capabilities and build up programs in our cancer in our breast cancer programs, right? And we are a program which comprises of specialists from numerous disciplines sitting down together and collectively come up with a treatment approach to our patients. So we have walked away from a single approach to a group approach.
Okay, so I would like to hear some more about the other, the medical facilities or the treatment facilities which are mostly feasible for the Bangladeshi patient. What sort of services do you provide from there?
I'll just give you an example, right? And the initial years, right, during our first time when we venture into foreign countries, right, usually they come for health screening, right? I mean, that's very normal. But over the years, I can tell you, our foreign patients come for every type of treatments in our hospitals, from medical to surgical to cancer treatments. So if you ask me, right, I would say our hospital is providing a very comprehensive care to the patients, right? And just not about cancer alone, but we also do cardiac. We also do sort of, we also do about heart, right? So we also do, even other disciplines like, medical specialty like geriatricians. So it is a full comprehensive kind of specialty that we offer to our patients.
Okay, when we talk about the, medical center that's situated outside of the country, the issue of cost effectiveness comes in, So how do you see, the feasibility of the patients from Bangladesh? How far it is an cost-effective option for the Bangladeshi patients to visit to your center?
Sure. I would like to quote another example. We have patients coming from Papua New Guinea, right? As far as Papua New Guinea, whereby they have to take a 2 transit in order to come to our hospitals. I mean, for a patient who just, making an effort, right, to take a flight for 24 hours to come to our hospital is massive. And the reason, one of the major reasons is, of course, right, the medical capabilities of our hospital is very high. The other major reason is also because of our cost is very, very affordable, and we have been always affordable. And that's the reason why so many patients, foreign patients, come into our hospitals. In fact, for those patients, they found that, right, if let's say they seek treatment in their own country, it's more expensive than when they take a flight, when they come to our country, they stay in the hotel, when they lump it together, the cost is still lower than the cost they seek treatment in their own countries. That's how affordable we are.
And do you find that that is also applicable for Bangladesh as well?
Definitely, I mean, apart from the affordability, as what I have mentioned just now, it's just not about the treatment itself. In fact, in Malaysia, right, in Malacca in particular, right, the accommodation is very affordable. You have various types of accommodation. You have you have the basic one, the more luxurious one. And the basic one can be as low as $15 US per night, which is very affordable.
Yep.
And this is very important, especially for those long stay patients, something like cancer treatment, right? Usually it would take longer period of time. So food, accommodation is very affordable, not just the treatment cost alone.
Okay, so that means all other things are also affordable very much.
Yes.
And you have mentioned about your, especially the cancer center, but we have come to know that your diabetic center is also claimed as a center of excellence. So do you like to say something about that?
Yeah, sure, because Malaysia having a prevalence of diabetes, about 18% and above. For those age 18 and above, right, about 18% of them is always has the prevalence of diabetes. So our diabetes center has been set up in a way that, right, we have also following certain the national clinical guidelines, and we are using a group approach. So we are emphasizing on physician governance, whereby we group a number of physicians come together, including the ophthalmologists, the cardiac, the nephrologists, and endocrinologists, all come together, right, and design a program for the patients. And we have a group of nurses which specialize in diabetes education and wound care, right? And we provide a holistic approach in which we're using online tools on apps, right, to monitor patients even when they are at home. So we provide an oversight and advise the patients. Whenever the data has not been uploaded, immediately our diabetes educators can reach to the patient and find out why, right? Because it's a lifestyle It's a lifestyle disease, right? We need to monitor, the effectiveness of the patient themselves also. So what we did in this program is that we integrate between when they are at home, when they are getting the data at the outpatient level and the inpatient level. So it is a holistic approach, and it is a 24 hours monitoring of their health status.
Yeah, that's a very praiseworthy process that you have mentioned. So when we are talking about for the Bangladeshi patients especially, do you have any special offers or anything to offer to the Bangladeshi healthcare travelers?
Well, we have a number of, we come up with a number of special package, right, for the Bangladeshi to come over to hospitals, right, and it is very affordable. I was given information in the range of about, maybe $300, right, and it inclusive a number of things. So I think it is a good start, right, and to give a introduction to the Bangladeshi people to come over to experience Malaysia hospitality. And just to tell you, right, our hospital, because we have been very experienced doing medical tourism, we have a lot of facilities whereby in taking care of the sentiment of a foreign tourist. And from our experience, we always want the foreign tourists to feel that when they are in our hospital and there's a home feelings, for us that is very important, and we treat everyone as one family. We don't differentiate between Malaysian, non-Malaysian,
foreigners.
Yeah, we don't do that, because we feel that everyone is equal. But in fact, for foreign patient, we have additional service. We have concierge, we have coaches, we have our foreign exchange counter. You can change money in our hospitals. We have a business counter for you to buy tickets. We have arrangement with all the number of hoteliers surrounding us. So we have a holistic approach for the patients.
Yeah. Thank you, Mr. Stanley. It's time to take a short break, and we will definitely continue our discussion after the break.
Thank you.
দর্শক, আমরা কথা বলছিলাম মিস্টার স্ট্যানলির সাথে, যিনি সিইও মাকোতা মেডিকেল সেন্টার মালয়েশিয়ার। আমরা যাচ্ছি ছোট্ট একটা বিরতিতে। বিরতি থেকে ফিরে নিশ্চয়ই আরও কথা বলবো। বিরতি থেকে ফিরে আরও একবার স্বাগত নিটোল টাটা বিজ ট্রেন্ডসে। কথা বলছি আজকে মালয়েশিয়ার হেলথ কেয়ার নিয়ে। আমাদের সাথে অতিথি হিসেবে আছেন মাকোতা মেডিকেল সেন্টারের সিইও মিস্টার স্ট্যানলি লেম। Once again, welcome to our show. Let's discuss one thing on the especially in the breast cancer issues. WHO estimates approximately 1.38 million people every year actually are the victimized of these things, and around more than 458,000 deaths annually. So what kind of facilities actually your medical center provides to this breast cancer treatment and the patients?
Yeah, and just for your information, so right from many cancers we have been treated, right? Breast cancer is one of the highest prevalence one, and our hospitals is having a full team of people looking after this program. As I have highlighted to you earlier, we have relooked in the whole approach that we treat our breast cancer patients, and therefore this program was designed, right, specifically for the patient themselves. We have come up with a coordinator and navigator for this program because we understand, right, whenever a woman diagnosed with cancer, right, it's just not about the physical body, but it's the anxiety, the mind,
mental issues,
they don't know what to do, right? So we have this navigator, right, just to explain to the patients, right, the journey that they will go through and give them the best advice, best information so that they can make a better decision. Again, I want to emphasize, right, when we talk about a program, right, it's not a single approach, it's a group approach. So what we are doing is that, right, whenever the patients go and see a breast surgeon, right, the breast surgeon will discuss the case, right, with a number of surgeons and the other medical specialty, including the oncologists, and come up with a plan and tell the patient what's the next step that you need to do. Then our navigator will come in to explain to the patients, right, the journey of the treatment. At the same time, right, if let's say necessary, we always can refer that patient to have certain counseling, further counseling, to make sure that they have a peace of mind, so that they can make the decision what is the best for the patient. So after the patient decided, right, what to do, and it will proceed with the necessary treatment. So mind you, this is all been planned and discussed before the treatment being done. So it is very different from, compared to other hospitals, right, whereby you do first, then you treat. But we discuss first before we treat.
So it's a very consultative and, you know,
That's
I must say it's an empowering thing, you know. It empowers the patient that
it is,
it is by his or her choice it takes place.
And because we are JCI accredited, right, and in fact, you know, we decide to go for the JCI Clinical Care Program certification for this BEST program. We are the only hospitals and the first hospital who are going through this Clinical Care Program certifications. So it is indeed, right, bringing the treatment approach to next level. And for us, we think patient's right is very, very important. And patients have to be furnished with the right information for them to make the best decision.
So how do you get the response from the patients and the attendants so far?
Yeah, the patient found that it is a new experience. They never thought they have this kind of tools to empower them, right? Those days it's always the patient, the doctors tell them what to do. Now they decide what to do, you know, based on the information.
And they have all the information and the options.
Yes, based on the information has been provided to them, right? And moving forward, right, our hospital would like to have more of this kind of program, not just for the breast program, but the gynae program, the colorectal programs. So all these program-based approach will empower the patient to make the best decision for them.
So I would like to hear something from you about the teleconsultation. As you know, when we are talking about the foreign medical treatment and others, many a times we cannot visit in person. So what sort of teleconsultation facilities do you have for the new patient and also for the follow-up patients?
So during this teleconsultation come across when we have these pandemics, right? And as I have elaborated to you before, because we have so many foreign patients then, right? A lot of patients, they cannot come to see us. So we have to embark on something, right? That's where the teleconsultation come in, and it helps a lot, especially for foreign patients. So the teleconsultation is available for new and existing patients, and we provide these facilities, right, to our patients, especially in overseas. And the overseas patient find that it is very useful for them, right? Especially sometimes they haven't decided whether they want to come to Malaysia or not. So what they can do, have a first consultation first, let the doctors having the certain diagnostic investigation information, and let them to have a conversation so that the prospect patient feel comfortable before they come over to Malaysia for treatment or Makota for treatment in that sense.
Okay. Oh, that's interesting. Can you say something about especially your cardiac services, because we have talked a lot about the cancer issues and other issues, but we know that you have a very good center for the cancer hospitals as well.
Yeah, in fact, right before that, just want to highlight to you, and we are the only one of the hospital in Malaysia who even do a transplant. We do a kidney transplant services in our hospitals, right? And there's very few private hospital in Malaysia is performing kidney transplant surgery, and we are one of them, you know. And of course, right, CABG, the cardiac services is one of our services as well. We do provide the normal stenting, you know, we do provide the bypass surgery, and in fact we do bypass for BIZ patient as well. And even for the vein harvesting, we are using an endoscopic skill set to harvest the vein. So in fact, right, we have been managing many cardiac patients, right from the start, standing right up to bypass, you know.
Okay, interesting, very interesting. For Makota Medical Center, when we are talking about this, and especially for the Bangladeshi patients, people always want to see actually what sort of international accreditations does that hospital has. So what sort of accreditation do you have from the international entities?
So we have been getting a lot of awards over the years, right? And I just can't remember all of them, you know, because I always fly here and there and receiving awards, right? But what is most important for us in terms of medical excellence is always the international accreditations, which is JCI, right? Joint Commission International, and it is internationally recognized. Of course, we have other accreditation program in Malaysia as well. And over the years, right, because we are following a JCI kind of clinical standard, we have built up our capabilities. So we are not just good in terms of service, but we are also very strong in terms of medical capabilities. In fact, we are very few private hospitals in Malaysia doing a lot of collecting data and eventually publish it. We are one of them. In fact, our breast program, let's say for example, come back to a cancer program, our breast survival rate for the stage 1 to 4 is about 81%, which is compatible to UK and US as well. Okay. So it shows that the hospital is not just about, good in terms of services alone, but we are also very much into all this clinical data collection, clinical outcome publishing, so that eventually we can prove ourselves, right? We are providing an equivalent international benchmarking care to our patients.
Thank you very, very much. It was nice talking to you, Mr. Stanley Lam. Thank you for joining to our show.
Thank you.
দর্শক, কথা বলছিলাম মাকোতা মেডিকেল সেন্টার মালয়েশিয়ার সিইও জনাব স্ট্যানলি ল্যামের সাথে, এবং আলোচনা থেকে যেটি উঠে এসেছে মাকোতা মেডিকেল সেন্টার সম্পর্কে কী ধরনের সেবা তারা দেন সেটি এসেছে বিশেষ করে ক্যান্সার চিকিৎসায় এবং ব্রেস্ট ক্যান্সার চিকিৎসায় তাদের সফলতা যেটি আন্তর্জাতিক মানের, সেই কথাগুলো এসেছে। এবং বাংলাদেশি যেসব রোগীরা এখান থেকে সেবা নিতে চান সেখানে খরচ কীরকম হবে এবং অন্যান্য বিষয়গুলো এই আলোচনায় উঠে এসেছে। নিশ্চয়ই যাদের এই ধরনের সহযোগিতা প্রয়োজন, চিকিৎসা প্রয়োজন, তারা বিবেচনা করবেন যে মাকোতা মেডিকেল সেন্টার মালয়েশিয়া আপনার জন্য যথার্থ গন্তব্য কিনা। অনেক ধন্যবাদ যারা এতক্ষণ ছিলেন আমাদের সাথে আজকের এই আলোচনায়।